Hello everyone. In this video, I am going to talk about gross anatomy of hand. In this, I am going to cover the features of the skin, superficial fascia and muscles of the hand. The human hand is prehensile organ and is capable of grasping precision movement for skilled work and is chief tactile apparatus. The human hand presents a palmar or grasping surface and a dorsal surface. The skin of the palm is thick, richly supplied with sweat glands and is immobile. It is devoid of hairs and sebaceous gland. The bones of the articulated hand includes the carpals, metacarpals and phalanges. The 8 carpal bones are arranged in 2 rows. Each row has 4 bones. The proximal row bones from lateral to medial are scaphoid, lunate, triquetrum, pisiform, and the distal row of bones from lateral to medial are trapezium, trapezoid, capitate and hamate. The superficial fascia of the hand is made up of dense fibrous bands and anchors the skin to deep fascia. The superficial fascia contains a muscle called palmaris brevis and superficial metacarpal ligaments. Palmaris brevis is a subcutaneous striated muscle across the base of the hypothenar eminence. The origin of palmaris brevis is from the flexor retinaculum and palmar aponeurosis. The insertion is to the skin of medial border of the hand. The nerve supply is by superficial branch of ulnar nerve. Action of palmaris brevis is to improve grip by steadying skin on the ulnar side. The palmaris brevis is the remnant of the panniculus carnosus muscle, which is a subcutaneous muscle. The deep fascia. The deep fascia is specialized to form the flexor retinaculum, the palmar aponeurosis, which is thick in the central part and thin over thenar and hypothenar eminence. And one more modification of the deep fascia is fibrous flexor sheets of the digits. The palmar aponeurosis is triangular in shape. Its apex is directed proximally towards the wrist and the base is directed towards the root of the fingers. Thus, its features are, it has an apex, base, medial and lateral border. The apex of the palmar aponeurosis blends with flexor retinaculum and is continuous with palmaris longus tendon. The base is attached to proximal to head of metacarpals, divides into 4 slips. These slips blend with the fibrous flexor sheets of corresponding digits. The medial border of palmar aponeurosis is continuous with deep fascia covering the hypothenar muscles and the lateral border is continuous with deep fascia covering the thenar muscles. The function of palmar aponeurosis is to improve the grip of the hand and further it protects the underlying tendons, vessels and nerves. A clinical condition called as Dupuytren's contracture is a progressive fibrosis in the medial part of palmar aponeurosis, thickens to form a permanent contracture. As a result, the proximal and middle phalanges are acutely flexed because the palmar fascia is attached to them. The fibrous flexor sheath, which is a modification of deep fascia, is thickening of deep fascia on the anterior surface of digits and arching over the long flexor tendons. It extends from the head of metacarpals to base of distal phalanx, proximally continuous with the slips of palmar aponeurosis, attached to the margins of phalanges and palmar ligaments of interphalangeal joints. So each osseofibrous tunnel contains the flexor digitorum superficialis and flexor digitorum profundus tendons. Next, Talking about the flexor retinaculum, it is a strong fibrous band thickening of the deep fascia in front of carpal bones. So it bridges the anterior concavity of carpus and converts it into osseofibrous tunnel called as carpal tunnel. The flexor retinaculum is attached medially to pisiform and hook of hamate and laterally to tubercle of scaphoid and crest of trapezium. The structures passing superficial to flexor retinaculum are ulnar nerve, ulnar artery, palmar cutaneous branch of ulnar nerve, tendon of palmaris longus, palmar cutaneous branch of medial nerve, superficial branch of radial artery. The structures that are passing deep to the flexor retinaculum are the tendons of flexor digitorum superficialis, tendons of flexor digitorum profundus, tendon of flexor pollicis longus, median nerve, tendon of flexor carpi radialis passes through a separate canal in the flexor retinaculum. With this, we'll move on next to the intrinsic muscles of the hand. The intrinsic muscles of the hand are grouped as the thenar muscles, adductor pollicis, hypothenar muscles, lumbricals and interossei. The thenar muscles are abductor pollicis brevis, flexor pollicis brevis and opponens pollicis. Talking about abductor pollicis brevis, the muscle takes its origin from tubercle of scaphoid, crest of trapezium and from the flexor retinaculum. The insertion of abductor pollicis brevis is lateral side of base of proximal phalanx of the thumb. The action of this muscle, as the name suggests, it helps in abduction of the thumb. Next is flexor pollicis brevis. The origin of this muscle is divided into a superficial head and deep head. The superficial head takes its origin from flexor retinaculum, whereas the deep head takes its origin from trapezoid and capitate. The insertion of the muscle is to the lateral side of base of proximal phalanx of the thumb. As the name is suggesting, the flexor pollicis brevis, it helps in the flexion of the thumb. Next muscle of the thenar eminence is opponens pollicis. So this muscle takes origin from flexor retinaculum and from the crest of trapezium. The insertion is lateral half of palmar surface of first metacarpal bone. The action is it helps in opposition of the thumb. All the three thenar muscles are supplied by the median nerve. Next, talking about the adductor pollicis. Adductor pollicis, it is supplied by deep branch of ulnar nerve. This muscle takes its origin as an oblique head and a transverse head. The oblique head takes its origin from capitate and bases of second and third metacarpal bone, whereas the transverse head takes its origin from the ridge on the anterior surface of third metacarpal bone. The insertion of adductor pollicis is to the medial side of base of the proximal phalanx of the thumb, and the action is it helps in the adduction of the thumb. The nerve supply is by the deep branch of ulnar nerve. Next, talking about the hypothenar muscles, there are three again, that is abductor digiti minimi, the flexor digiti minimi and opponens digiti minimi. The abductor digiti minimi muscle takes its origin from pisiform and tendon of flexor carpi ulnaris, and the insertion is the ulnar side of base of proximal phalanx of little finger. Action is abduction of the little finger. Next muscle is flexor digiti minimi. So this muscle takes its origin from the flexor retinaculum and from the hook of hamate. The insertion of flexor digiti minimi is to the ulnar side of base of proximal phalanx of little finger. The action is flexion of little finger. Next is opponens digiti minimi. So this muscle takes its origin from the flexor retinaculum and hook of hamate. Insertion is to the medial surface of shaft of fifth metacarpal bone. Action is opposition of little finger with the thumb. All the hypothenar muscles are supplied by ulnar nerve. Now, next we are talking about lumbricals. Lumbricals are 4 in number, first, second, third and fourth. Now, origin of the lumbricals, that is first and second lumbricals, they are unipinnate and it takes its origin from lateral side of lateral two tendons of flexor digitorum profundus. Third and fourth lumbricals are bipinnate and it takes its origin from adjacent sides of medial three tendons of flexor digitorum profundus. The lumbricals are numbered from lateral to medial side, first, second, third and fourth from lateral to medial side. The insertion of lumbricals are the lateral side of dorsal digital expansion of corresponding digits from second to fifth. Next, talking about the nerve supply. First and second lumbricals are supplied by median nerve. Third and fourth lumbricals are supplied by deep branch of ulnar nerve. The action of lumbricals are, it flexes the metacarpophalangeal joints and extends the proximal and distal interphalangeal joints. Now, interossei. Interossei are grouped into two, that is palmar interossei and dorsal interossei. Palmar interossei are unipinnate and dorsal interossei are bipinnate. The palmar interossei, that is the first palmar interossei, takes its origin from medial side of the first metacarpal bone and insertion is to the dorsal digital expansion and medial side of proximal phalangeal phalanx of the thumb. Second one, from the medial half of the palmar surface of shaft of second metacarpal, it is its origin. Insertion is to the dorsal digital expansion and medial side of proximal phalanx of index finger. Third and fourth interossei takes its origin from the lateral half of palmar aspect of the shaft of fourth and fifth metacarpal bones and insertion is to the dorsal digital expansion and lateral side of proximal phalanx of fourth and fifth fingers. Talking about the dorsal interossei, all are bipinnate as I mentioned. The first dorsal interossei takes its origin from adjacent sides of shaft of first and second metacarpal bones. Insertion is to the dorsal digital expansion and lateral side of proximal phalanx of index finger. The second dorsal interossei takes its origin from the adjacent sides of shaft of second and third metacarpals and insertion is to the dorsal digital expansion and lateral side of proximal phalanx of middle finger. The third dorsal interossei takes its origin from the adjacent sides of shaft of third and fourth metacarpals and insertion is to the dorsal digital expansion and medial side of proximal phalanx of the middle finger. Fourth dorsal interossei takes its origin from adjacent side of shafts of fourth and fifth metacarpals and insertion is to the dorsal digital expansion and medial side of proximal phalanx of ring finger. The actions of the interossei are, the dorsal interossei, they are abductors, whereas palmar interossei are adductors. The nerve supply of the interossei, all the palmar and dorsal interossei muscles are supplied by the deep branch of ulnar nerve. Thank you.